Hey guys, how are you? I guess you're having a great day. My name is Richard and I want to welcome you to our channel, The Daily Health and Weight Loss. I want to say thank you so much. If you've been watching our videos, we love you and appreciate you. We hope you are getting quality knowledge. But if this is your first time of watching my video, please subscribe to my channel and hit the notification button so that you won't miss important videos. We will be discussing infertility common causes in men and women. Infertility in partners could result from problems such as impotence, smoking, obesity, age, infection, ejaculation disorders, and radiation. In the United States alone, up to 15% of couples are not fertile. There are many causes of infertility, but we will analyze some of the common causes and what to do to avoid it. Smoking. We already know the dangers of smoking cigarettes on our health. It does not only affect the lungs, but it also affects the health of the entire body. Smoking has caused a lot of health issues in both men and women. Heart problems such as cancer, heart diseases, and other health problems. But does smoking affect sperm production? The answer is yes. It can affect fertility in men, and the negative effect it has on sperm is much stronger. This is because a study has shown the negative side effects of smoking on sperm health. A meta-analysis was published a few years ago. The analysis was done with over 3,000 men. The study proved that the decrease in sperm count is caused by smoking. Heavy smokers not only have a high risk of lung health, but can also be infertile. Addictive substances such as alcohol and drugs also have a potential risk factor for male infertility. Infection. Infections such as untreated gonorrhea, syphilis, tuberculosis, and hepatitis can cause infertility in both men and women. Study shows that syphilis in women can be a risk to pregnant women. 30% of women who are not fertile is due to the problems from afflicted infection. In men, some infections can negatively affect sperm health. There are some dangerous infections that can damage sperm production. However, sperm production in most times can be restored. For men to get their partners pregnant, caution should be taken to avoid infertility. Take note of any infertility symptoms such as sexual problems, erection issues, testicle pain, ejaculation disorder. There is a difference between premature ejaculation and ejaculation disorder. Premature ejaculation does not cause infertility in men. It can be a difficult matter and not easy to talk about, but it is a common problem among men. Ejaculation disorder or ejaculation issues, on the other hand, can cause infertility in men and can be a big threat to the health of the sperm. One of the major reasons why most men are infertile is due to ejaculatory problems. Radiation. It is understood that infertility in men could be affected by heat and intense exposure to radiation and hazardous substances. In the world today, we are surrounded by a lot of radiation which could damage sperm production and reduce sperm count in men. The radiations are derived from laptops, phones, Wi-Fi, and microwaves, ovens, as these are the common things we use in our everyday lives, which have an impact on the causes of infertility. If you want to be safe from the dangers of radiation, you have to keep all cell phones away from the testicles to prevent fertility issues. Laptops should not be placed on the laps when being operated, instead should be placed on decks. These things are not to be left without caution as they have a big negative effect on infertility. Obesity. Obese and overweight women have a high risk of reproduction. A study has found that many obese women still ovulate, but there is a reduction in the quality of the eggs they produce. And also, men that are overweight and have obesity have a lower fertility rate. Obesity is a common problem in women who are struggling to conceive. It includes excessive fat that badly affects the body. Obese and overweight women have lower chances of getting pregnant. This is due to higher miscarriage rates among them and lower pregnancy rates. Prevention. While we elaborate on the topic of infertility common causes in men and women and the prevention, we will state the best things to do to avoid being infertile. Quit smoking and avoid drug or tobacco use. Avoid drinking too much alcohol. Stay away from sexually transmitted disease. Avoid anabolic steroids for sports or bodybuilding. I hope you are getting quality knowledge of infertility common causes in men and women. Please drop your comments below telling me what you think. And if you are enjoying this video, please like and share too. Signs of infertility. I know someone who was first diagnosed with infertility at the age of 31. In his case, the inability to get his wife pregnant was the result of a state called stage 4 endometriosis. Like so many people struggling from infertility, he was so sad and depressed by the news. He had always thought that he would have a large family. He was devastated. It is not an uncommon issue among partners to experience infertility. So many couples have no symptoms. They do not have any signs to find out if they may have problems in conceiving until they start trying to. For this reason, it's recommended for people who have been trying to conceive for more than a year without no sign of pregnancy should visit a doctor. The chances to get pregnant reduce for women above 35 because infertility problems increase with age. Signs and symptoms of infertility. Signs and symptoms of infertility are often related to other underlying conditions. There are different types of conditions that can lead to infertility in both men and women. The signs and symptoms of every issue can be different. If you feel concerned about the following signs, you can consult your doctor. Common signs of infertility are as follows. Common signs of infertility in women. Improper periods. The average cycle but if it occurs within a few days, around the 28 days, you have no reason to worry as long as the cycles are consistent. If a woman's cycle varies that she does not even know her periods will arrive, or she cannot estimate the days of cycle might be, she is experiencing an abnormal period. These conditions can be due to hormone problems and contribute to infertility. Painful or heavy periods. A lot of women out there experience pain when they are on periods, but heavy periods that hinder one's daily life may be a sign of adenomyosis. No periods. It is not an uncommon issue if a woman has an off month here and there. An element like stress or heavy workouts can contribute to the primary disappearance of the period. But if a woman has not had a period for months, then it is time for a fertility checkup to avoid infertility issues in the future. Signs of hormone change in women. Symptoms of hormone fluctuations can signify possible issues with fertility. Consult a doctor whenever you experience issues such as facial hair growth, hair thinning, gaining weight, skin problems, and the reduction in sex drive. Pain during sex. A lot of women are experiencing painful sex for a long time throughout their lives. This has made them believe it is normal. But it is not so. It could be associated with hormone issues, adenomyosis, or other basic conditions that could also contribute to infertility. Common signs of infertility in men. Changes in sexual desire. The fertility of a man is related to his hormone health. Changes in manliness, often controlled by hormones, can signify issues with being fertile. Testicle pain or swelling. Men experiencing pain and swelling in the testicle can be due to a lot of different conditions, many of which can contribute to infertility in men. Problems maintaining erection. The ability to maintain an erection is sometimes associated with hormone states. Reduced hormones can result in an erection issues and could lead to trouble getting a woman pregnant. Ejaculation issues. A man who is unable to ejaculate during sex has a problem, and it is advised that you consult your doctor immediately you notice these symptoms. Small firm testicles. The testicle is a house to the sperm, so the testicle health is crucial to male fertility. Small testicles could signify possible issues that could be inspected by a medical expert. Conclusion. Around 15 to 20% of partners who are trying to conceive will have problems with infertility. If you have confirmed your condition being infertile, or you have the fear that you might have issues conceiving in the future, then you are not the only one with such. The medical industry is forever making researches and progress in finding an adequate solution in this field. Do visit your doctor and seek for medical advice whenever you are concerned with these infertility common causes in men and women, and abide by the prescription given to you over your medical problems. It is a fact that you may still conceive even if you are diagnosed with infertility. Thank you for watching my video on infertility common causes in men and women. I hope you learned a lot. If this is your first time of watching my video, please subscribe to my channel and watch the other videos on my playlist.